Hello, I'm Urologist Erdem Akkaya. Today we're going to have a video presentation about growth hormone, insulin-like growth factor. The reason why I wanted to talk about this, is because I believe growth hormone releasers will soon be a part of treating hypogonadism along with testosterone. Because in hypogonadism, it significantly increases the effectiveness of testosterone therapy. It started to be used in America and Europe, and publications on this are being made. While the amount of growth hormone is high in childhood and youth, it starts to decrease slowly in advancing ages. We see that in this graphic. It is released by the liver in the body and plays an active role in many organs. The final subject I'm going to talk about here is actually IGF. If we briefly talk about the effects of IGF in the body. Studies have shown that it increases muscle mass in the body. It has a wound healing effect in catabolic conditions and in wound healing situations. It improves performance exercises and physical exercises. It can play a positive role in sexual functions. It also has positive effects on sleep and increases the time of deep sleep. It has positive effects on testicles and reproduction. It may have positive effects on vascular health and vascular calcification. It can prevent thinning of the skin by increasing the amount of collagen in the skin in anti-aging practices. It has positive effects on elderliness and depression. It can have a protective effect on the brain tissue and nervous system, and can make a significant increase in lean muscle mass for bodybuilders. If we check the growth hormone releasers, many growth hormone releasers have been detected so far. Some of them have been patented and some not. The unpatented ones are sold on the internet, and in black markets, they are produced in underground labs. Their story is very long. Even the growth hormone releasing hormone could be synthesized in about 25 years. Publications and studies on IGF have been being carried out for about 40 years. Sermorelin, which got patented first. In the meantime, a lot applied for patents, but most of them could not get them. Testosterone got the last patent in 2005 from the FDA. In this diagram, you can actually see the basic mechanisms of growth hormone releasers. Growth hormone releasers are divided into two wings: growth hormone releasing hormone and ghrelin derivatives. After the growth hormone releasing hormone is released from the hypothalamus, it stimulates the hypophysis and provides the release of growth hormone. In the other wing, there is a hormone called ghrelin which is released while the stomach is hungry. This hormone pushes the release of growth hormone and increase of IGF by affecting hypophysis and other many tissues at the same time. If we check growth hormone releasing hormone analogs, there are two basic wings. One is sermorelin and the other is testosterone. Sermorelin consists of the first 29 peptides of normal growth hormone releasing hormone. It should be applied 3 times a day or before bedtime. It has an indication to prevent muscle loss in children with growth hormone deficiency or patients with AIDS. But since it was applied 3 times a day, it was difficult to use, so they tried to modify it. Then Mod GRF 129 came out. Then, CJC 1295. The most important feature of it, it can stay in the blood for 8 to 10 days, it provides a very powerful growth hormone effect, also it's selective, which means it only produces growth hormone. It sounds advantageous, but the firm terminated the studies of CJC because one of the subjects died in the process of study. But it's still sold in black markets. This is the most powerful, longest effective one among growth hormone releasing hormone analogs. Here you see combination therapies. It can be used in combination with growth hormone releasing peptide 2. Here you can see how the potency increases when used in combination. The last patented product is testosterone. It is more expensive than others but approved by the FDA. In the other wing, there are ghrelin derivatives. Ghrelin has many derivatives, but there are basically 5 of them sold. Unfortunately, there is none among them that has received FDA approval, but they are sold widely in Compass pharmacies which sell magistrate medicines. At the same time, the FDA did not prohibit them, I have to say that. Here comes ipamorelin, which is considered the most harmless, most preferred in anti-aging centers or by functional medicine specialists, and does not increase other hormones, namely prolactin and cortisol. Apart from that, growth hormone-releasing peptide 6, 2, MK67, and hexarelin have more effect on prolactin and cortisol. Here we see the description of ipamorelin. Ipamorelin increases the appetite very slightly. It has a moderate effect on the growth hormone. As I said, it has no effect on cortisol and prolactin. Here you can see a graph showing how ipamorelin increases growth hormone. It increases in the first few hours and hits 0 in the 4th hour. You can see the graph of growth hormone releasing peptide 2, also known as pralmirelin, and how it increases. Increase in growth hormone in both the elderly and the young. Those can also be used in combination with sermorelin. There is only one study on this. Apart from that, growth hormone releasing peptide 6. Peptide 6 increases growth hormone less than peptide 2. It has a strong appetizing effect. It moderately increases growth hormone, also increases cortisol and prolactin moderately. In this graph, you see the increase in growth hormone of ghrelin analogs 6, 2, 1, ipamorelin, and natural growth releasing hormone. The highest is 2, then ipamorelin and 6, respectively. 677 Malawian kwachas is the most money and effort spent between ghrelin analogs. Melkin worked very hard to get an indication for this medicine. Because it can be used orally, which is very easy for users. It completely eliminates the injection problem. I can easily say that millions of dollars have been spent to obtain an indication which is approval for a disease. Most of its studies have been made for bone healing in the elderly. They have extensive studies for up to 2 or 3 years. In MK677's latest study, that is, the reason why the study was discontinued, many users quit this medicine due to side effects. This rate is around 30 to 40%. As I said, it is actively sold in black markets right now. The biggest disadvantage of this, as I said just before, is that it increases prolactin and cortisol. Here you can see a few of the studies on 677 Malawian kwachas. Hexarelin is also an analog of ghrelin. Among these, we can call it the analog that increases growth hormone the most powerfully. You see it here on the graph. It increases growth hormone very strongly. You see growth hormone releasing hormones and growth hormone releasing peptides. Here in this graph, you can see how strong the effect is when the two are used together. This graphic is the most widely used graphic in publications. In this one, you see peptide cures from William Anabolic book. Many medicines have been used, respectively. 677 Malawian kwachas, CJC 1295 were also used. Again, it was used with 677 Malawian kwachas and CJC 1295. Here, sermorelin and ipamorelin were used together. The cures here have one purpose. It combines growth hormone releasing hormones with growth hormone releasing peptides. Because the two increase each other's effectiveness. In fact, the ultimate purpose of all the molecules I have described before is IGF-1, meaning IGF LR3, which is the hormone that creates the direct effect of IGF. It has 3 features. The most important one is its half-life in the blood is a lot longer compared to natural IGF, it's around 15 to 20 hours. The half-life in the blood of natural IGF is 20 minutes. It's so long when we think. It's a medicine that is resistant to binding the protein called IGF binding protein, which becomes inactive when IGF binds, natural IGF. And it's a 2 to 3 times more potent medicine compared to natural IGF. It works inversely with the growth hormone. While growth hormone causes hyperglycemia, IGF-1 causes hypoglycemia. And it's a dangerous hormone. When used before bedtime, it may put people into a hypoglycemia crisis. Here you see its description. So, what is the safety of them, IGF-1 or growth hormone? If they are so useful and so good, why are they not used in treatments? What are the risks? These should also be explained. It has been shown in studies that IGF-1 is associated with prostate cancer and colon cancer, that is, when it increases, the risk of prostate cancer and colon cancer increases. Of course, these studies are again limited actually. So it's hard to say exactly what it does. The most important thing is, I think, as IGF increases, lifespan doesn't actually increase. We can say that the experimental demonstration of mice with prolonged lifespans in IGF deficiency decreased the popularity of IGF. At the same time, it was determined that children who received growth hormone treatment due to growth hormone deficiency have higher mortality rates in the long term, compared to the population. I think the most important study that literally broke the neck of IGF is in a meta-analysis where 14,000 people attended. The ones with high IGF-1 levels had higher mortality rates. But in this graph, when you look at both ends of it, you'll see that both the ones with high IGF and low IGF have a high death rate. This means IGF should be medium depending on age. Based on this graphic, if you are 60 years old and have a low IGF level, you'll have a longer lifespan, but if you are old and have a high IGF level, you'll have a higher rate of death. As I said, it's one of the studies that damaged the popularity of IGF. But I still think IGF or growth hormone releasing peptides or hormones will in the future used for increasing the effectiveness of testosterone treatment in hypogonadism. Because studies on IGF still are ongoing. We can only see the total IGF in the blood, we can't see its free. We can't see IGF binding proteins. At the moment, we do not know exactly their interactions and functions in the body. But now, there are studies on this subject suggesting that if we reduce the IGF-1 level in the elderly, the lifespan may increase. Here, one of these studies where it's tried to produce growth hormone receptor antagonists. To answer the question of whether can we extend life in the elderly if we reduce the IGF-1 level. Thank you very much for listening so far, best regards.